This episode of PediaCast is brought to you by the Center for Pediatric Trauma Research at Nationwide Children's Hospital. Hello, everyone, and welcome once again to another episode of PediaCast. We are a pediatric podcast for moms and dads. This is Dr. Mike coming to you from the campus of Nationwide Children's Hospital. We're in Columbus, Ohio. It's episode 594. We're calling this one Infobugs, Contagious Transmission of Thoughts, Emotions, and Behavior. I want to welcome all of you to the program. We are so happy to have you with us. Kids catch more than colds. They can also catch ideas. And so today we're going to explore infobugs, which spread information infections online and through peer networks, sometimes fueling violence, self-harm, bullying, and even suicide. We're going to explore the world of infobugs as we help parents understand how these message bugs spread, warning signs to watch for, and how families can build strong mental immune systems and even spread beneficial infobugs like kindness and helping others. Of course, in our usual PediaCast fashion, we have a terrific guest joining us in the studio to discuss this topic. Dr. Henry Xiang is director of the Center for Pediatric Trauma Research at Nationwide Children's Hospital. He will be with us shortly. Before we get to him, I do want to remind you the information presented in every episode of our podcast is for general educational purposes only. We do not diagnose medical conditions or formulate treatment plans for specific individuals. If you're concerned about your child's health, be sure to call your healthcare provider. Also, your use of this audio program is subject to the PediaCast Terms of Use Agreement, which you can find at PediaCast.org. So let's take a quick break. We'll get Dr. Henry Xiang settled into the studio, and then we will be back to talk about infobugs. It's coming up right after this. Dr. Henry Xiang is director of the Center for Pediatric Trauma Research at Nationwide Children's Hospital and a professor of pediatrics at The Ohio State University College of Medicine. He has a passion for keeping kids, teenagers, and families safe by raising awareness and preventing the spread of infobugs. Now, you may be asking yourself, what in the world are infobugs and why are they an important consideration for parents? Well, you are about to find out, but before we dig in, let's offer a warm PediaCast welcome to our guest, Dr. Henry Xiang. Thank you so much for stopping by the studio today.
Thank you so much, Dr. Mike, for having me here.
Yeah, we're really happy to have you, and I'm excited to talk about this because I really feel like this is one of those things that parents may not have heard of before, but by the end of our conversation, I think it's going to make a lot of sense to them. Well, why don't we start with just a definition? What exactly is an infobug, especially for families who are hearing this term for the first time?
I coined the infobugs in 2022 a paper I published in Injury Prevention. I call the infobugs, in a simple language, is nine-form small unit of information such as messages, images, posts, and stories that can infect people's thoughts and emotions, similar to how germs infect our body.
Yeah, it's a really unique way of thinking about it, but it really is true in, just like bacteria or viruses invade and cause sort of dysfunction of an organ system. When we do come across misinformation and bad information and what, you coin infobugs, really does get into our head and can then lead to changes in behaviors. And then, of course, there are consequences to changes in behaviors. And so that impacts health outcomes and wellness and all of those things. In today's world, it would seem, especially with, online and digital presence and a lot of Americans just being constantly on the internet, or at least, it's in their pocket and we get notifications and such. I'm sure that that helps the spread of infobugs, but are there other things that make these things more likely today compared to years past?
Yeah, I think the social media and the internet play an important role in spreading all of those infobugs. I will mention that also infobugs are not always harmful infobugs. There are also some good infobugs such as happiness and candles. Scientists has shown that both type of infobugs can spread in through the network of human beings. So
Yeah, and I find it's like reading a review for something that I'm going to buy on an online shopping site where you read the reviews before you do something, and often there are lots more bad reviews than good reviews of things that may be good because people who are happy with the product just use it, and the people who aren't happy complain. And so you do get this impression that things are more negative than maybe they really are. And in the case of infobugs, we think of them as being harmful because often, especially as medical professionals, we come across information out there that's, can be misleading or is not evidence-based. And so the sort of bad infobugs out there really grab our attention. But as you mentioned, there are good infobugs too. We can spread kindness and all of those things, right?
yes, so many scientists have published papers and studies about contagious happiness, contagious kindness. You use the example there, like reviews, and every day people are rely on reviews to reserve like a hotel, to reserve like a restaurant. Some of them bad and some of the good. But in reality, actually, people are using those informations there. So
Yeah, yeah, absolutely. And people use infobugs too and it sort of normalizes harmful behaviors because when we see other people doing a particular behavior, we just think, oh, that's a normal thing, and not always think, is this a good thing or a bad thing? Why do some infobugs normalize harmful behavior?
yeah, I think I don't have a comprehensive theory about that, but some people trying to spread violence messages, or some people unintentionally spread some negative thoughts. For example, there are some evidence, scientific evidence showing, suicidal ideas could be contagious through social network. Some of them are spread intentionally, some of them are spread not intentionally. I think this is a new scientific area that we need to work together to advance.
So in that case, the info bug is someone talking about suicide or harming themselves, and then you see it and you see it, and maybe you see it a third time, and it starts to become more of a normal thing to consider. And then we do see kids who, in response to suicides, often you see clusters of those, or you hear about them
Yeah.
in the media. And I would imagine that there are some of those kids who may not have carried out a plan except for the info bugs that kind of normalize that this is an okay thing to do.
Yeah. So, what's differentiated my theory from other theories or previous theories is we need to treat the information like a life form agent. So, if we think about the transmission or spread of infection disease, we think about agent. In the old models, usually it's virus or COVID-19 virus and other bugs, flu bugs. And then second factor is the host or the people who are infected by those viruses. And third one is the environment. We can use the exact same model of epidemiology transmission in the infobugs transmissions or spread. For example, we have to figure out what's the original agent of that message, either a violence message or a suicidal message spread. If we can do that, we can develop some interventions to prevent that from spreading in the social network. So that's very important for us to put that in that triangular model of infection disease. In a way, we will treat the Infobugs spread.
Yeah. So in that model, as we think about prevention, so disease prevention, we want to avoid contact. We want to wash our hands often. We want to get immunizations to protect against particularly harmful agents that can cause illness. And in this case, what exactly is it then that we can do to prevent harmful impacts of these infobugs, especially as we think about self-harm and suicide?
Yeah. So the advantage of having a conception model like that is we can sort of like think about or design programs that will prevent the spread of harmful information or promote the spread of beneficial information. For example, let's talk about the agent. So if we find out violence messages or a suicidal negative messages becoming in this social network, there are way for, I'm not saying that's, the society still need to make a agreement on whether that's a good way or we don't want to, prevent people express their thoughts or opinions, but there are certain violence message needs to be watched and need to be dealt with. That's the agent piece, and then the host piece is talk about people. There are some vulnerable people over there. We want to prevent them from exposure to those violence or negative thoughts, such as parental supervising of internet use or social media use. That's exactly the interventions we can use based on those triangle model of disease transmissions.
Yeah, I saw in the news that Australia passed a law recently banning social media use in folks less than 16 years of age. I'm not sure how they are going to enforce that. I don't think that that is something that would go over very well in the United States, just in terms of our culture. But the point of parents supervising internet usage is something that families can do. Although, the degree to which you can do that is also limited to some degree because most preteens and teenagers have phones in their pocket with connection to the internet, and it may be very hard to police, what they come across. So I would think similarly to vaccines preventing illness when one of those organisms does invade our body, sort of a vaccine would be in my mind. And I know this has maybe not been studied, but if I were to present a hypothesis for future work, I would think that just parents on a daily basis, just talking to their kids and seeing, what are their thoughts? What are they thinking about? What's important that's going on in their lives? And whether that's happening at the dinner table or during car rides or whenever it is, I would think that communication between parents and their kids just to help with insight and critical thinking and those sorts of things would be helpful. But I don't know how you test that.
Yeah, actually, that's a wonderful idea. There are some scientists also had published some papers about similar ideas. They call the mental immune system. So, you brought up a very important point here. Different culture may view those things differently, and then you brought up Australia is a little bit more westernized culture. Also, I came from China, so actually the Chinese government is doing something like that to curb the harmful informations in the internet. I'm not saying that is right or wrong, but that's different culture has different attitude towards this kind of like message spreading, all of those things. But bottom line is, I think as a society, we need to spread beneficial infobugs and trying to find some ways to stop or reduce the harmful infobugs, because that just those harmful infobugs were not only harm our children and adolescents, but also are not good for the benefit of the whole society and the human beings.
Yeah, absolutely. Speaking of China, there was a study involving about 13,000 Chinese teenagers that related to the contagious aspect of bullying. Can you talk about that study?
Yeah, I'm honored to collaborate with my colleagues in China. So I immigrated to the United States about 30 years ago. I still have some connections there. I think I feel so grateful to this country. This country gave me the opportunity to build my careers here and then build my life here. I feel so grateful to this. That study is a large study. We surveyed 13,000 middle school and high school students and ask about their using universal IDs to protect their privacy, and ask them about their friends and friends to friends, up to 10 of those friends. And then we look at, ask them to report 6 types of bullying behaviors, which include physical bullying, relational bullying, sexual bullying, precision bullying, or verbal bullying. And what we found out, actually, bullying behaviors in the school social network can spread in their network. And also, most importantly, if one student have observed more bullying behaviors, they are more likely to bullying other people. So that those relationship is important in our scientific field. I think that one has significant implications for the schools to develop programs to reduce bullying among students.
Yeah, and when you think about bullying that happens online, often there are observers and an audience of that bullying. And so even if you're not the one that the bullying is directed toward, the more that you see it, the more it becomes normalized. And then it is easier for us to sort of respond to things that may be causing us stress in a bullying sort of fashion. And so just by observing it happening to others can increase the incidence. And I suspect that's the kind of thing that this study showed.
Yeah, I actually think put that in this concept of the Infobugs. Actually, the what was happening in that social network is kind of the message there to say, a bullying is acceptable, and then some of the maybe class leaders and if they are doing this, other observers or students normalize that, okay, it's acceptable as okay. But in reality, actually, bullying has a significant negative consequences on individual mental health and some of the physical health also. So that's the beauty of this Infobugs theory and the epidemiological transmission models that we can use to explain and design interventions.
Yeah. So as I understand it, the bullying really then in this study of 13,000 middle and high school students in China, the bullying clustered in friendship clusters. So it wasn't random. So if you had a friend group where there was bullying, that spread within that group so that there was even more bullying compared to a friendship cluster where there was no bullying to begin with. And there continued to be no bullying, again, because of what becomes normalized behavior. And so the more that you are around bullying, the more you're likely to do it yourself. And that's why a lot of people who are bullied actually do bully others. There's a lot of folks kind of in the middle there. They're being bullied and being the bully. But it just shows us that just like a contagious illness, when we're exposed to these negative ideas and thoughts and behaviors, then we're more likely to do them. And the other thing too that I thought was interesting with this study is that so if you were maybe not in a bullying cluster and you are friends though with someone who is in the bullying cluster, then that could actually spread to the other cluster of friends, and suddenly bullying becomes normalized in a group that it wasn't normalized in before. So you're not only impacting your own group of friends, you may be impacting other groups of friends that are around you.
Yeah, that's exactly true. That's why we call bullying can be contagious in a school social network.
Yeah. Yeah. So then what can parents do? Like, I mentioned, at the dinner table, sort of normalizing the conversation of, hey, what's going on in your life? How are your friends doing? What's stressing you out? And I feel, again, this is anecdotal and just based on life skills, not necessarily research. But I think that that's probably easier to do the younger kids are. Like, once kids are teenagers and a parent maybe hasn't been asking daily, like, hey, what's up? Then it becomes a little weird from the kids' point of view. But if you sort of normalize the conversations between parents and kids from an early age, it does become a little easier because, again, you've normalized. In this sense, open communication is a positive info bug within a family, right?
Yeah, you are right. In the American culture, our children tend to have their own protected privacies. When they get older and older, become teenagers and young adult, they don't want to share everything with their parents. But there are always some warning signs or some signs you can pick up during your dinner conversation with your children, particularly when they were young. So parents need to think about what their children exposed. Violent, video, hateful post, glorification of self-harm, and who they are connected with. Oftentimes during a conversation, a casual conversation, you can pick up some warning signs or some clues about what's going on. For example, you can even pick up the warning signs of suicidal ideas and negative thoughts, during those conversations. So that's very important for parents to be closely involved in your children's activities and friendship building and sports and all of other stuff.
Yeah. Yeah. I do want to point out here real quick, and please correct me if I'm wrong about this. So infobugs can impact behavior when kids and teenagers see particular things, hear particular things from their friends, and it can kind of spread. And we talked about self-harm and suicidal ideation being one of those things that can spread like that. On the other hand, as I understand it, there is no evidence that parents talking about suicide with their kids increases the risk of suicide in those kids. So in other words, what I'm saying is you may hear this and say, well, if kids hear about suicide, they're more likely to start thinking about it. But from a parent standpoint, it is okay to talk about suicide, and that doesn't increase your kids' chances of actually thinking it or doing it.
I think we have to go back to the maybe scientific evidence. In my personal opinions, is the way how you frame that topic, right? So talking about, if as a parents or grandparents, if you are talking about suicidal events in the society, how do you frame that topic is important. You want to have a good positive conversation with your children. You don't want to have some talk there normalize that behavior, right? So, and also in my personal opinions, my wife and I, we came to the United States. The first 5 years were very hard, and we struggled a lot during that period. Sometimes I learned from that negative talk, positive thinking and positive talking will help people avoid that negative and suicidal ideas. So even though we know that, the problem is among some of the immigrant families here, they kind of view suicidal depression, bad things and bad things are taboo. They don't want to talk about. I think that's not helpful. You need to, if you find out your loved ones have negative thoughts and suicidal ideas and depression, you need to encourage them to seek professional help, particularly the medical help first.
Yeah, absolutely. And so if you, in your conversations with your kids, if there are warning signs, things like lack of interest in things that used to interest them, them talking about suicide or self-harm, it's sort of knowing what's happening in your kids' friend group. Is there someone who is struggling with self-harm ideas? Is there someone who committed suicide? And then, if you're able to tell that those things are going on, then that's a great time to talk about it and to let your kids know that you care for them and you love them and you want the best for them and you can talk about anything is all going to be important. And then, as you say, if your child is going down that route, then you definitely want to get professional help. Where do parents start with that? Where do you look first for help?
It depends on the severity of the depression or suicide ideas. I think, professional help, I mean the medical help first. We have mental health services here, and we have a great psychologist here. You need to contact them and trying to arrange the, professional visit, treatment here. Those cases needs to be evaluated by the professionals here. Nationwide Children's Hospital is a great hospital. We have an expert in this area.
Yeah. And for families everywhere, your regular doctor, your kid's primary care provider is going to be a really great place to start because they are seeing families who are impacted by similar events and have experience with who in your local community you can refer someone to. So even though they may not be the mental health expert, they know who the mental health experts are and can point you in the right direction. And I'm sure they would be happy to hear from you as a parent if you have any concerns. What are some practical family level steps that parents can do to prevent the spread of harmful infobugs?
I think, open conversation about what the kids see online and the school. And also maybe, if you feel concerned about some of the languages or some of the bullying behavior at your school, you need to go out and reach out to the school administrator to say this is not acceptable. We need to do something together. Parents groups, sometimes also could be very powerful in the communities. So there are a lot of ways, a lot of channels for you to take actions. I think the bottom line is to pay attention to those warning signs and take actions.
Yeah. It's really important for parents to advocate for their kids in that manner. And sometimes we have to be the squeaky wheel and do something we may feel, like you said, getting in touch with the school administrators. Some parents may feel very comfortable with that and sort of welcome the conversation, and other parents may dread it and really not want to get involved. And I guess just letting those parents know that, it's not an easy thing to do, but you're not only having an impact for your own kids, but likely you'll be having an impact for other kids in similar situations because hopefully, school policies will change, and it's certainly worth any discomfort that those conversations may cause. But I just want to say, for parents out there, it's not an easy conversation sometimes, right?
Yeah, you're absolutely right. We're talking about our own children or grandchildren, but in some of the situations, your children or grandchildren can pick up some negative things going on among other friends. If you see serious warning signs there, you take actions. Actually, you are helping those children and adolescents. So,
yeah, absolutely. Now, you mentioned that infobugs are not always negative. There are beneficial infobugs. How can parents sort of seed those in their families? How can we use positive Infobugs to help our kids' mental health?
You bring up a very good point now. I'm doing a research and trying to build this new concept called family resilience into our research programs. So there are a lot of situations the families will have adversities, negative experience, and challenges. What often happened is we did not emphasize enough the family resilience will play an important role. Let me give you an example. So if your loved one suffered a severe TBI, traumatic brain injuries, if your loved ones, your children or grandchildren suffer moderate to severe traumatic brain injuries, they will definitely have a lot of negative mental health issues. During the recovery period, we trying to encourage the family members or caregivers to have more positive attitude and the positive communications with the patient, but also among the family members. Because that's kind of the new concept of beneficial infobugs. If you use that approaches, you are trying to circulate positive atmosphere in your families. And that will definitely help the patient to recover from the traumatic brain injuries. I use the traumatic brain injuries as an example, but also there's so many examples and situations you can apply the infobugs, such as depressions. Depressions sometimes can be severe and long-term. Positive family environment, beneficial infobugs, and encouraging messages are very important.
Yeah. Yeah. So again, as we've talked about on this show before, modeling behavior, behaving in a way we want our kids to behave in toward them. Yeah. And we do see that a lot, in my work in the emergency department. We'll see kids who come in, let's say, with abdominal pain, but it's not new belly pain that just started that morning. Maybe it's been going on for months. And then as you start digging in, you begin to realize that these kids are impacted by depression and negative thoughts and perhaps bullying and thoughts of self-harm that often go along with those chronic belly pain. And from a parent standpoint, when you sort of, I don't want to say, I'm not suggesting that parents ignore their kids' symptoms, but sometimes when you pay too much negative attention towards something, then it becomes more ingrained that, oh yes, I do have a bellyache. Maybe the parent's asking day in and day out, how's your belly feeling? And instead of sort of modeling, hey, let's go do something. Let's get your mind off of this and let's, find ways that we can improve your quality of life and improve your friendships and those sorts of things. So really from a parent behavior standpoint, that can make a big difference in kids' lives.
Yeah, absolutely. So chronic pain is another area my research team is working on. So you are absolutely right. So positive attitude, good behavior, and trying to treat that, chronic conditions as a part of your life, and then trying to lead the normal life patterns, and those are very helpful.
Yeah, yeah. Now, there are Infobugs that impact parents too. And so I think as we talk about this, if parents think about in their own lives, what are some potential Infobugs that may be impacting them? And, especially post-pandemic, there seems to be more and more of an overt sort of attack on science, in terms of even at the federal government level, as we think about immunizations and the, evidence backing science. And there is a lot of Infobugs relating to associations that may not be cause and effect. We can, as we look at vaccines, for example, we can read reports that you see, teenagers passing out when they have a particular vaccine. And was it the vaccine itself that did that, or was it more the, getting the vaccine causes you to be stressed, which can suddenly lower your blood pressure and increase your heart rate and make you feel faint. So it wasn't necessarily the vaccine itself that caused a kiddo to pass out. It was more the whole environment. But the info bug is that this shot is harmful. It makes kids have a short episode of unconsciousness. And so I think what I'm encouraging is just for parents to think critically about the stuff that they come across, because they are also being bombarded by info bugs on a daily basis. And the vaccine thing is just one example. There are many others.
You're definitely right. I think, parents need to carefully read those messages and not take it for granted to say, okay, this message makes sense or this is true. You need to seek scientific evidence to have a balanced view of those things. So,
yeah. And then that then really introduces the role of our peers and the media, because those are the areas where we are getting our information from. So our peers being, other parents on social media, other people who, may be concerned about vaccines, for example. Certainly the news stories that we see on television and online and on the radio and newspapers and all. We really are just in today's world being bombarded with information, and some of it is good, some of it is bad. And the more that we, really try to think about things critically and try to find evidence, and, the more that we play an active role in looking things up, especially if we're understanding how science works, is going to be helpful rather than just accepting the negative stuff that we see.
yeah, I think, we as an individual need to view things from two different perspectives, some particularly opposite views, and trying to understand, what they are talking about, what evidence they have, and, be open-minded about all of those issues. I think as citizens, I think that's the role we can take.
Yeah. So then as we close out, what is a hopeful message for parents in all of this? Because I feel like there's a little bit of a gray zone, right? I mean, if we could just wave a magic wand and make all these info bugs go away, that would be helpful. But we can't do that. So, what's a message of hope for parents in the increasing number of info bugs that are out there?
I think the hopeful message is, as a scientist, we are trying to conduct scientific project and research to benefit the whole societies and the human beings. I think this Infobugs theory will help us to deal with not only harmful Infobugs, but also, develop those a good program will have beneficial Infobugs. So as a scientist, I think I have an important role to play in this, in our activities and our projects.
Yeah, absolutely. Well, this has been a very interesting conversation and an important one. For folks who would like to learn more about this, I'm going to have a couple of links in the show notes to actually journal articles that Dr. Xiang was involved in. So one is the British Medical Journal, BMJ. It's called Infobugs, Agents for Contagious Transmission of Violence, Suicide, and Other Social Events. We'll put a link to that one. And then Dr. Xiang was also senior author on an article in Computers and Human Behavior called The Contagious Spread of Bullying Among Chinese Adolescents Through Large School-Based Social Networks. And again, we'll put links to both of those articles in the show notes, which you can find over at PediaCast.org. It's episode 594, and you'll find them right there. So once again, Dr. Henry Xiang with the Center for Pediatric Trauma Research at Nationwide Children's Hospital. Thank you so much for stopping by and chatting with us today.
Thank you so much.
We are back with just enough time to say thanks once again to all of you for taking time out of your day and making PediaCast a part of it. We really do appreciate your support. Also, thanks again to our guest this week, Dr. Henry Xiang, the director of the Center for Pediatric Trauma Research at Nationwide Children's Hospital. So this is our final episode of 2025, and I want to take this opportunity first to thank each and every one of you for showing up and listening to the podcast. I get lots of comments from you guys in social media, also through our contact page, and also at the hospital. Just folks stopping me in the hallway and saying, "Hey, I listened to PediaCast and really enjoy it." And so I just appreciate your support over this. Well, it's been many years, but in particular this year, just really do appreciate all the support from the audience. We are planning on starting strong in 2026. We are scheduled well into the new year and have some great topics in store for you. But I did want to take this time again to say thanks and also to wish all of you a happy holiday season. I hope you have a wonderful time with your families. You're able to take some time off work. It may not be on the actual holiday. Being in medicine, I understand needing to work on holidays, including Christmas sometimes. But even if it's not on the actual day, just getting together with family and friends and loved ones and, taking care of each other and hopefully spreading good Infobugs this holiday season. Don't forget, you can find our podcast wherever podcasts are found. We're in the Apple Podcast app, Spotify, iHeartRadio, Amazon Music, Audible, YouTube, and most other podcast apps for iOS and Android. Our landing site is PediaCast.org. You'll find our entire archive of past programs there, show notes for each of the episodes, our terms of use agreement, and that handy contact page if you would like to suggest a future topic for the program. Reviews are helpful wherever you get your podcasts, and we always appreciate when you share your thoughts about the show. And we love connecting with you on social media. We're on Facebook, Instagram, Threads, LinkedIn, X, and Blue Sky. Simply search for PediaCast. Also, if you are a pediatric provider, we do have a program for you. It's similar to this one. We turn the science up a couple notches and offer free continuing medical education credit. And it is a Category 1 credit for those who listen. And that includes physicians, of course, but we also offer Category 1 CE credit for nurse practitioners, physician assistants, nurses, pharmacists, psychologists, social workers, and dentists on that program. Shows and details are available at the landing site, PediaCastCME.org. You can also listen wherever podcasts are found. Simply search for PediaCast CME. And then if you are academic faculty at a college of medicine, or any of the health sciences, we do have a faculty development podcast for you. It's from the Center for Faculty Advancement, Mentoring, and Engagement at The Ohio State University College of Medicine. So if you're a teacher in academic medicine or, again, a faculty member in any of the health sciences, it is a podcast for you. And you can find Famecast at famecast.org, and wherever podcasts are found, just search for Famecast. Thanks again for stopping by. Happy holidays to everyone. I hope you have a wonderful time with family, friends, and loved ones. And until next time, which will be in the new year, this is Dr. Mike saying stay safe, stay healthy, and stay involved with your kids. So long, everybody.